If you're like most medical practices, you're drowning in after-hours chaos. Your providers get bombarded with non-urgent calls at the wrong time. Your patients feel like they can't get help when they need it and may leave bad reviews, hurting your reputation. This nightmare is only getting worse when your practice grows. But what if I told you that practices who've eliminated this chaos all follow the same templates? So here's what I've noticed. There are two types of practices. The first type is always putting out fires. Doctors get disrupted by non-urgent calls in the middle of the night. Patients are frustrated to not hear back from them in a timely fashion, and practice managers and support staff are stressed because they carry the burden of managing all patient messages. But the second type runs smoothly. Their doctors can sleep through the night, their patients feel heard, and staff handle any situation confidently. The difference is they rely on a completely different model than traditional call management. I know because I've worked with hundreds of practices, single clinicians, multi-location groups, and specialty clinics, helping them make this exact transformation. You just downloaded our voicemail script templates because you know getting your prompts and call tree right isn't just a nice to have. It's the first piece of the puzzle to running a successful practice. In the next few minutes, I'll walk you through why clear voicemail menus matter, the most common mistakes practices make, and the best practices top clinics use to protect providers and keep patients happy. Stay until the end and I'll show you the exact tools successful practices lean on to make this easy to manage every day. So here's the problem. For most practices, 80% of after-hour calls are routine. But if your menu makes urgent the first or only option, patients can default there. And providers get woken up for appointment requests, prescription refills, or even fax number requests. One practice we worked with had a 36 provider facility where every single call went to a provider's cell phone. Not the best setup to protect your provider's time. And that could also lead to scenarios like patients being left in the dark or even worse, life-threatening situations. I want you to think about your call tree as your first line of defense, especially after hours. It's there to coach your patients to self-select the right path. When your prompts are clear, patients feel reassured and trust that you'll take care of them for both urgent and routine needs. They'll know when to wait until the office opens, and they'll know exactly when it's time to reach that on-call provider. Without this foundation, every other tools you have or think about implementing, could it be a call service or an on-call scheduling solution, end up managing one thing, noise. And that's why voicemail prompts and call menus are a crucial first step. So what goes wrong in most practices? It could be that urgent is listed as the first number one, or maybe you're using one giant leave a message inbox that can funnel everything to the on-call doctor and leaves everyone frustrated. When that's the case, you're most likely missing important details from these messages, only to spend hours of phone tag to try to figure it out. You may also rely on live agents to manage after-hours calls when your staff is not available. The problem is most traditional call services rely on agents who aren't actually medically trained. They could interrupt the doctor at the wrong time or share sensitive information that goes against HIPAA regulations. So let's get into the voicemail templates and how top practices use our model instead. This practice had an issue with their providers getting woken up in the middle of the night with routine matters all the time. As you can see on their call flow, we take a little time to give them some basic information about their office hours here. Maybe you want to have your fax and address hours up front so providers don't waste time answering simple questions. And then the biggest change that they made was making the routine options first. So those routine refills, appointments, this group provides transportation options for their patients, and maybe billing options. All of those have routine inboxes here that the office staff can check. This group was successful in implementing structured prompts based on the types of routine calls that they get overnight. And we created an administrative inbox for each option for those patients to leave a message, and those office staff members could then return the call the next morning and handle those routine matters. And then, of course, they have their urgent option listed last, where the physician on call can be contacted for those truly urgent matters. Another successful practice that we worked with was a women's group. We had tailored options for the specialty of the call. They were an OB/GYN group, so they have an option for OB and an option for GYN, because although it's similar specialty, as you know, many differences there. For OB, they talk about if your water breaks, go to the hospital now. You can also leave a message for the on-call provider and gives them some information of reasons why they would maybe need to go to the hospital rather than leaving a message for the on-call provider. As you can see, we also have our urgent matters last in this workflow. It seems a little counterintuitive, but it is effective. So clearly define what counts as urgent for your practice. Route those urgent calls to those schedules with an escalation, and this lowers the false urgent calls without risking patient safety. So the first group that we looked at, they cut their urgent messages to 2% by updating this voicemail script here and putting their routine matters first. And our women's health clinic stabilized their urgent volumes at 16% after these OBGYN prompts in very specific verbiage here. We also have a cardiology group that dropped their urgent read times down to 2.7 seconds with tuned escalation. Remember at the beginning when I promised to show you the exact tools successful practices use to put this on autopilot? Well, here's where PerfectServe comes in. You now understand that better voicemail menus are just the foundation, but here's what most practice managers tell me. This makes perfect sense, but I don't have time to set it up properly, train my staff, and make sure it actually works. So that's exactly why we've helped over 30,000 practices implement these systems. We take the templates and best practices I just shared with you and customize them for your specialty, your office, and get you set up and running in about 2 weeks. Here's what makes us completely different from those traditional call services you might be thinking about. We're built exclusively for healthcare, not plumbers, not HVAC companies, just medical practices like yours. And beyond just fixing your voicemail prompts, our system handles everything. Your on-call schedule syncing that actually works when doctors swap their shifts, one-tap holiday and weather closures, and intelligent routing that gets the right calls to the right people at the right time. If you want to see how this would work in your practice, you can try it now for 30 days. If after 30 days you don't love it, you walk away. No charges, no hassle, no awkward conversations. Here's what I'd love to do for you. Book a free discovery call with my team. Bring these voicemail templates you just downloaded and your thoughts on them, and we'll help you customize them for your specialty. Whether you decide to work with us or not, you'll walk away with a clearer, more patient-friendly script that actually protects your providers. The 30-day trial spots are limited because we want to make sure every practice gets the attention they deserve during setup. You can click the button below to schedule your discovery call, and let's get your after-hours chaos under control once and for all. I'll talk to you soon.